Hi, Dr. Mark Agresti. Today's topic is obesity and what we can do about it. What is obesity? I think obviously people have some idea that it's excessive body fat. It's basically your BMI greater than 30. What does that mean in layman's terms? You're 20% overweight. So what causes obesity? I mean, the most common reason people are obese maybe is not their fault. It's genetics. You have the gene for obesity. Your mother, your father, grandparents, brothers, sisters, aunts, uncles, they're obese. Therefore, you will be obese. But there's also the issue of lifestyle. If you live an inactive life, if you have friends that eat too much, if you live a life around food, alcohol, you will tend to be obese. If you work as a job at a desk where you never move, and you never move on the weekends, and your entertainment is eating, well, you will be obese. Inactivity is one of the key indicators of obesity, not moving. An unhealthy diet. What would be an unhealthy diet? Packaged foods, complex carbohydrates, trans fats, sugar, white flour, those would be the culprits. Not enough fresh fruits, vegetables, lean meat, chicken, those would be considered healthy. Economics and social issues. Well, if you don't have enough money to afford healthy food, you will become obese. Eating packaged foods, fast food, foods that are readily available and cheap will lead to obesity. So it's expensive to eat healthy, and we all know that. What medical problems cause obesity? Well, a common one is underactive thyroid causes obesity. Treatment with steroids, so people with lupus or kidney diseases and who get steroids, asthmatics, become obese. The body produces its natural steroid in Cushing's syndrome called cortisol, and if you have Cushing's disease and high cortisol, you'll become obese. Women going through menopause may become obese. Just being in menopause causes obesity. From a psychiatrist standpoint, stress leads to obesity. Depression, anxiety disorders lead to obesity. Poor sleep quality, sleep apnea, results in obesity. We all know if you stop smoking, that can cause obesity. There's another illness called polycystic ovarian syndrome in women. That can cause obesity. Heart disease, where your heart's failing, that can cause obesity. Kidney disease, liver disease can result in obesity. Acromegaly, which is a pituitary issue where you're producing too much growth hormone, that can cause obesity. Ovarian cancer can lead to obesity. What are the risks of being obese? Well, if you're obese, your blood pressure goes up. You become hypertensive. If your blood pressure goes up, you become hypertensive, you will get a stroke. Stroke could leave you paralyzed or kill you. You can get diabetes where your insulin doesn't work anymore and your blood sugar skyrockets. Coronary artery disease where there's too much fat deposition in the arteries that feed the heart and the heart doesn't get enough blood and you get a heart attack and you die. Too much weight on the body causes osteoarthritis. Most commonly ankles, knees, hips. Cannot support the weight of your body. It destroys the joints. And the joints, when they're destroyed, cause pain. Obesity leads to cancer. Cancer of the prostate, colon, gallbladder, pancreas, kidneys, uterus, cervix, endometrium, and ovaries. It's a long list. Obesity causes sleep apnea. Can't sleep because there's so much weight on your chest. It obstructs the airway. It can cause a fatty liver. Fatty liver could be deadly. It can cause kidney problems, fertility problems in both men and women, unable to have children. It can lead to gallstones. Also, there's a host of psychiatric illnesses caused by obesity. One would be depression. Obesity can cause depression. It can cause anxiety. It can cause social anxiety, fear of being around people. It may lead to isolation. Obesity may lead to people spending more time indoors just because it's too much effort to walk outside. They don't get enough sunlight. that predisposes them to obesity? Not enough social interaction. There are all sorts of social isolating syndromes caused by obesity. A host of factors in terms of sleep and diet, which cause obesity, may exacerbate or cause depression, anxiety, panic disorder, social anxiety disorder, and avoidant personality type illnesses. How do we fix all this? One, key one, more fiber. So what does that mean? Fiber in your gut forms like a paste or a gel that decreases absorption of calories, and it fights body fat in itself. That would be one. I have 15 good ones, so follow me. Avoid trans fat. Read the labels. If it says trans fat in the packaging, and most things in the center of the grocery store, anything that's in a plastic wrapper or a box has probably got trans fat. Margarine, spreads, cookies, candies, all sorts of packaged cupcakes and cakes and spreads and stovetop this and extra crispy crusts and shake and shovel and bake and everything like that has trans fats in it. So it causes inflammation. Inflammation is not good. Inflammation is what destroys the body. It causes coronary artery disease, heart disease, diabetes, increased belly fat. No good. I say this over and over in my videos. You cannot lose weight. You will become obese if you drink alcohol. There are some studies that you could have a little alcohol a day. I find very few people can moderate it. But for men, less than 7 drinks a week. And for women, sorry women, but less than 3.5 drinks per week. Wah. Another way that you can lose weight is high protein diet. Yes, the high protein diet is the best way to lose weight. What's protein? Eggs, chicken, meat, fish. There are plant-based proteins. Look into those, but stay high protein. Another, number 5, would be stress. Avoid stress. Stress causes increased cortisol. And remember I said increased cortisol is Cushing's syndrome? Well, increased cortisol causes increased appetite, increased fat storage, and obesity. 6, for things you can do not to gain weight, not to be obese. No sugary foods, no soda, no cakes, cookies, candies, anything with sugar in it. Number 7 on my list to lose weight and not be obese. Aerobic exercise. That means moving your body continuously. Biking, running, playing a sport, that you're continuously moving your body. If you want to lose weight, number 8 on the list would be carbohydrates. Pastas, bread, rice, decrease carbohydrates, decrease weight gain. Here's another little caveat. Number 9, use coconut oil, avoid other types of oil. Using coconut oil in your cooking helps you lose weight. Number 10, resistance training. That means lifting weights or lifting your body weight. Doing something where your muscle is pushing against gravity or a weight. You must, number 11, must have adequate sleep. Number 12, eating fish with omega-3s. The more omega-3s you eat, the more you will lose weight. Number 13 would be intermittent fasting, 1 to 2 times a week, having 24 hours without eating. The last 2 would be drinking green tea or eating slowly. Thank you, Dr. Mark Agresti. I hope this was helpful.